Good evening, everyone. Thank you for joining us. And despite a very busy leading up to Christmas and the New Year, I appreciate everyone who has spent the time to join us this evening. So today is basically a bit of an opportunity for us to talk a little bit about workforce wellbeing, and particularly some of the work that the Royal Pharmaceutical Society and Pharmacist Support have been working on for the last couple of years collaboratively together. Before I go into that, I think it's only right by just talking a little bit about the incredible role that pharmacists and their teams have played over the last 12 months. But I think it goes beyond this to say that this, for many people, is very common. We know that pharmacists and their teams are the front line of the NHS across England, Scotland and Wales, and provide a vital service to many people from in their communities, whether you're working community pharmacy, hospital pharmacy, general practice, other areas of academia. There's always a pharmacist that has some part to play with delivering better patient care and health. But particularly during COVID, we have seen the valiant efforts of pharmacists and their teams on the front line. And it goes just a matter of just to say thank you for everyone's efforts and energy that have gone into the last few months to support people during these really tricky times. We know that pharmacists continue to remain busy during the pandemic right here and now, but also with winter pressures being amongst us all. And it's really important, with that being said, that we make time to look after our own mental health and well-being, but also support and look after our colleagues. At the RPS, we're really proud of all pharmacists and their teams, particularly going above and beyond the call of duty every single day, putting their patients first. And what has been really fascinating as part of this piece of work that we've been working together on has been hearing some of the incredible stories that pharmacists have been doing to support patients, children, families, out of hours type support as well, which has been extremely encouraging and is part of some of the work we've been doing to highlight the great work pharmacists have been doing to government and the NHS. Today's webinar is a chance for us to share the results of our recent survey with you, but also to ask for your views and opinions on where you would like this to go and what you would like RPS and Pharmacist Support to take on going forward, what changes you would like to see, what action you would like to see as well. It gives me great pleasure today to be introduced by a fantastic person, Danielle Hunt from Pharmacist Support. I just wanted to give Danielle an opportunity to introduce yourself and give a bit of background about what Pharmacist Support do.
Thanks, Ravi. Evening, everyone. I'm Danielle Hunt, the Chief Executive of Pharmacist Support. Pharmacist Support, if you don't know, is a professions independent charity. We provide a range of free and confidential services for pharmacists right through their journey, from being a student all the way through to retirement. And I think it's really great to be part of this event today, because we're really keen to get feedback. We're constantly developing our services, particularly around wellbeing. So any questions, as Ravi said tonight, we'd be keen to hear those. Any feedback, anything that you think you need from us over the next few years, really keen to hear about that.
Thanks, Danielle. And just a massive thank you to you and Pharmacist Support for your continual collaborative work on this really important agenda. So this evening, what I thought would be useful for us to cover is why we are focusing on workforce wellbeing across both organisations, going into a bit of the detail around some of our recent survey findings and what has that shown us, looking at some of the key themes and issues that have come out of that survey. And to just go back a little bit, we've got 2 years of data currently at the moment, which is showcasing consistent themes. An opportunity also for Pharmacist Support to give some of their perspectives on what they've been dealing with over the last 12 months, but over the last couple of years in particular. And then we'll hop on to a Q&A session with yourselves to sort of get your own opinions and try and answer what questions you might have. But we're really keen to use this as an engagement exercise to understand what else we could potentially do, but also enable you to shape some of the activity that we take on going into 2021. So as I mentioned earlier, please feel free. This is a safe environment. We want people to be able to speak freely, provide valuable suggestions, and we're all here to support each other and be professional around these suggestions. So please feel free to ask any things that you might have, any issues that you've been experiencing, any examples of best practice that you'd be willing to share with us as part of this piece of work would also be fantastic. But also particularly, how do we create positive well-being within our working environments and workplace would also be great to get some of your insights and advice on that. So, pharmacist wellbeing. I think in the introduction we alluded to the fantastic efforts that pharmacists do day in, day out to support members of the public. And I think what COVID-19 has shown us, particularly in the first wave of the pandemic, was the fact that the mental health of our healthcare staff should be at the forefront of everything that we should be doing and supporting as we go forward within the NHS. I think it was clear to see that pharmacists are the unsung heroes, or actually well-established heroes, as part of the COVID-19 response. But we know that, particularly in the first wave of the pandemic, the stress levels were high, it was uncertain, we didn't really know what to expect from the pandemic, but still, pharmacists adapted. They became agile in their environment. They did things when they weren't given the advice or the guidance to. They responded to the needs of members of the public using their professional judgment and clinical autonomy, which was absolutely fantastic to see. I think throughout that, adrenaline probably took us to a certain place in probably July, where we just continued with the business as usual and tried our best to support members of the public. I think as we've gone into the winter months from September, we've seen ourselves going into a second wave across all of our countries in England, Scotland and Wales, where various types of lockdown activities come into place and the demand increasing alongside that winter pressure element of things. And what we're now seeing from a lot of the workforce, not just from pharmacists, is this continual battling away with the day-to-day business while trying to deliver COVID support for many members of the public. And what we're really fearful of is long-term burnout of our pharmacy workforce going forward. And so, as part of this work, we knew this was really important this year to continue our commitment to annually surveying our members to understand what the current situation was. And we started to undertake some of this work in 2019. We wanted to try and assess the impacts, but also publish the findings. And I think it's really important to contribute to the evidence base around pharmacy workforce when I compare it to doctors and nursing as a workforce who have established evidence bases around some of these particular areas. We really want to advocate and create everlasting change for not just our current workforce, but the future generations of workforce as well. We want pharmacy to be an attractive career for future generations as well, and utilising the expertise, the insights that members and the profession are able to give us now can only try and make those type of situations better. And what we definitely want to do is, by working collaboratively with the charity, is by trying to work with other key stakeholders, employers, regulators, other organisations to try and support the profession and members going forward. So the aims of our 2020 survey, and I think it's all about lessons learned. So we learned a lot from our 2019 survey. I think Daniel can probably agree with me with that, about what type of questions to answer, what questions are good to answer, what questions are not so good to answer. And really we wanted to try and find out three key things. We wanted to try and get a better understanding of the root cause problems of poor mental health and well-being within the workplace, and trying to use that to try and produce mitigations to reduce that causation factor. We wanted to then try to understand what type of wellbeing support do our frontline healthcare professionals and other healthcare professionals across our profession have access to. What support service do they have? Do they have free access to mental health and wellbeing support, or occupational health services as part of their employed and part of where they're employed? We wanted to then try and take some of these issues and try to drive positive change by working with various organisations to try and do some of this stuff. So as I mentioned earlier, we developed our survey based upon lots of lessons learned from 2019 and streamlining this survey to make it quick and easier for people to do. We didn't want to do a long survey. We knew people were busy in the couple of weeks when we were running it. We wanted it to be easy to capture that data and also easy for analysis and be able to turn it around quickly for publication. Massive shout out to the people that we engaged with, right from our elected board members to RPS locals, Hospital Expert Advisory Group, our Early Careers Pharmacist Advisory Group, students, our Inclusion and Diversity Group, but also working with other Royal Colleges to understand what they had been doing, what type of questions they had been asking their workforce, so we could mirror and have a comparative with other healthcare professionals as well as a benchmarking exercise. We really wanted this report and the questions in the report to be a non-biased approach to our survey, so we didn't want to get negative answers only. We tried to engage with finding out positivities, who is enjoying their workforce, examples of good best practice to try and elevate that as well. And we opened this survey for about a two and a half week period at the end of September to middle of October. So responses today, I'll go into this. We had, and I believe it was about over 950 responses that we received all in total. But what we can see from this is there a breakdown of where we got those responses from. We received a significant proportion, over half, from community pharmacy colleagues. We received a good turnout from hospital pharmacy colleagues as well. One of the areas of biggest response growth was in general practice pharmacists across England, Scotland and Wales, and that's would be expected with different policies integrating pharmacists into this working setting. But what was also really good to see was the diversity of our workforce. We saw pharmacists from academia and education contributing, other areas across primary care, industrial pharmacy, prison service as well, but also it showed the breadth of other pharmacists working from care home pharmacists, working in health boards, commissioning landscapes, working in national policy positions as well. So we did get a good breadth of responses from the profession. So in total, we received, as I mentioned, specifically now, 959 responses in total. And just a bit of the demographics around some of the data, and the full report goes into much more of the detail around this. But from that response rate, we saw that 75% of that identified themselves as being from a white background, where versus 23% identified from being a Black, Asian, minority ethnic background. We also saw relatively in line with our professional, our GPHC data set, where a significant proportion of the response rates were from people who identified themselves as being female. And we saw responses age actually being from a large range of newly qualified pharmacists right to people who are even retired pharmacists at the moment, to give some of their insights and perspectives as well, which is great to see that richness. What has been really shocking to see that we saw that nearly 90% of all respondents were at a high risk of burnout. We had seen that over 70% of the workforce were negatively impacted over the last year, and that the workload had negatively impacted their mental health and well-being. And over 40% have said that their mental health was not in a good place in the current moment in time. What I think some of the shocking results was about people wanting to leave their jobs, but also wanted to leave the profession entirely. Over 1/3 suggested they wanted to leave their jobs within the next 12 months, and over 1/3 of people were wanted to leave their jobs, leave the profession entirely within the next 12 months. Where this was really common and where the trend was definitely seen was those pharmacists working in general practice and in community pharmacy were more likely to leave the profession entirely in comparison to other pharmacists working in other areas. As I mentioned earlier, we tried to demonstrate that there was positivity as part of this survey, and what was good to see is that over 50% of pharmacists as part of this survey really enjoyed their jobs. And some of the qualitative feedback that we saw was because of the COVID-19 pandemic, despite it being really stressful, pharmacists felt they were recognised for their clinical contributions to delivering better patient care and felt empowered, and their clinical autonomy and professional judgment was valued by other healthcare professionals and members of the public. What was also sad to see was in part of this, which was a smaller proportion, but nearly 1/3 as well, was that 27% suggested that they don't really enjoy their work and job. And there was a number of different reasons why that was as well. And some of those was that they felt that their demands being placed on them were too dear, they weren't supported enough, they were working in isolation and not having good supervision structures, they felt they didn't have enough staff to support them delivering their normal day-to-day activity, and particularly concerns and perceptions around safety of delivering proper healthcare to people by being under pressure was some of the reasons that contributed to people not enjoying their job. As I mentioned earlier, it would be wrong for us not to ask a question around how COVID has impacted people's mental health and well-being, and over 50% of people said that there had been a negative impact on their mental health and well-being as a result of the COVID-19 pandemic. Over 1/3 thought that it had significantly affected their mental health, and that's pretty expected, as you can imagine, within the current environment, both from in-work perspectives, but also a number of other factors that would affect work-life balance as well. What was really interesting, as I mentioned earlier, is the perception around the impacts that this could have to patient care, and something I think we're all concerned with. And when we look at other healthcare professionals, they're able to extrapolate some of the data around poor mental health and well-being, resulting in risks to patients. And some of the biggest concerns for pharmacists as part of this survey was the impact that poor mental health and well-being and stress and burnout would have on the quality of service that they deliver to members of the public, but the risk of making mistakes and compromising patient care as well. I think there's some of the interesting bits, and I'm sure Danielle will also have a view when I bring her in about some of the discussions about accessibility and visibility and people feeling confident about accessing wellbeing support services. What was actually really great to see was that over 60% of our respondents said they were aware that their employer actually offered mental health and wellbeing support service, or they had access to NHS-funded occupational health services. But only 14% of those people, considering that nearly 90% were at risk of burnout, had access to those support services to support them during the last 12 months, or even within the last few years. 32% were unaware that services were even available, even the current ones that are being commissioned by the NHS, or even awareness of pharmacist support, for instance. And what was really interesting was that there was a slight discrepancy around the accessibility of these services between our pharmacists from a Black, Asian, minority ethnic background in comparison to those from a white background. As I mentioned earlier, it did see that many employers are offering mental health and wellbeing support services, but what was really shocking was that over 40% said that they weren't comfortable in accessing these services, and there's something that we found around destigmatization of accessibility of services around this, but also the fact that there was people felt that they could be discriminated on, particularly if they were to access mental health and wellbeing services. It could compromise their job, particularly our locum pharmacists who are really worried about future job roles and potentially getting future work in the future. I repeated future for twice there. And what was really interesting was that what was really good to see is that 70% of our respondents had heard about the independent charity pharmacist support. 13%, however, only thought they knew a lot about the charity and the services they offered, and 36% knew only a little about what the charity offered. And I think what Danielle will talk about later is some of the work that they're doing to try and increase this elevation. I think the collaborative work between us as an organisation with Pharmacist Support can also help address some of those things. So I suppose I wanted to benchmark a little bit about what does this say from our data last year. So on the left here we have our data sets from 2019, and on the right we have some of our data sets in 2020. And I appreciate some of the resolution might not be great, but they're on our website if people want to check this out. And people would have thought, with the pandemic, you would expect our results to be significantly poorer in comparison to 2019. But what was really interesting to see that there was not much difference in the data sets despite us going through a whole pandemic, which demonstrates that there are underlying issues associated with poor workforce well-being within the pharmacy profession that need to be addressed, even though we had gone through a global pandemic, for instance. And what was interesting is how this compares with how other healthcare professionals. And we have seen this in the media and in the evidence bases from various journals about the impact that COVID-19 pandemic will have on all of our healthcare and frontline staff across health and social care. Pharmacy is not isolated within this. But also what we're seeing is that nursing and doctor colleagues are presenting similar type of data findings currently in a very similar time frame of publications. And we're all trying to work together as Royal Colleges to try and work with government and NHS to try and make this situation currently better. We're also seeing some evidence build up in pharmacy, and my colleague Adam Rathbone sent some stuff from the University of Newcastle today around the impacts of stress and anxiety on the pharmacy workforce that's happened over the last 12 months, and it corroborates very much with the data that we're also finding across both RPS and pharmacist support. What was really great to see in some of the survey was some of the feedback we got from members and people like yourselves who were interested in this topic and wanted to try and make this make it better for not only ourselves but for future generations. And some of the ideas from respondents we got were absolutely brilliant. Trying to get engaged and supportive line managers through better leadership, coaching activities, trying to formulate a culture which is part of a cohesive team, people feeling a sense of belonging, feeling that they can demonstrate and raise awareness and raise risks around some of this stuff and feel confident to gain access to mental health and wellbeing support services. The role of mental health and wellbeing champions within the workplace as a point of contact to go to for support, raising awareness in the workplace, regular communications, ensuring that people in the workplace understand that they have access to occupational health services, mental health services, resources to support them on a day-to-day basis. Opportunities to do funded training, but also some work for the RPS and pharmacist support to do to support the profession around workshops, activities to try and help with their mental health and well-being. In some working environments, having access to safe spaces and wobble rooms, which is a really new concept, and I've done a bit of learning around that myself, around what's the value of those and how can they contribute to the working environment. There have been some hospital trusts in particular who have been able to integrate these into their ways of working, which has been really fascinating. And even some general practices have been able to integrate this type of space areas within their GP surgery for people to get rest during the day, for instance. And what some of the key things what we found from members was the causation factors are around heavy workloads, poor staffing levels, lack of rest breaks and time off to get that time to restore your energy levels, to get that appropriate work-life balance. And some of those key things that we need to take forward need to address those fundamental causes. So 2 years of data, and some of the themes that we are definitely seeing is that we appreciate that the pharmacy workforce is at high risk of burnout. Many will say that under 1,000 sample size is probably a small sample size, but when we're collating data sequentially over years and years between RPS and pharmacist support, I'm sure the data set is a lot bigger than that, but we ourselves at the RPS have over 2,000 qualitative data entries around this and a growing evidence base around this is a common theme that the pharmacy workforce is at high risk of burnout. Pharmacists, unfortunately, are not aware of the support that might be available to them. So how do we try and promote this? How do we make it more accessible? What are the reasons why people can't get access to this type of support? And there are other factors that can also affect people's mental health and well-being, and particularly around the culture of an organisation, the culture of a workplace also has a detrimental impact on workforce well-being, as does increasing workload and inadequate staff levels as well. So the 3 key areas that RPS want to work on with partners, including pharma support, but other healthcare organisations, pharmacy leadership organisations, government, NHS, regulators, as mentioned earlier, is really firstly around the prevention of cause. How do we help prevent the cause? Is that around appropriate staffing levels? Is that appropriate breaks, flexibility in opening hours for various healthcare professionals could be particularly helpful, funded access to trainings to support leadership, workload management, for instance. How do we look at preventing the cause of poor mental health and well-being? Because as we know, prevention is better than cure. Workplace culture has been a consistent theme, not just within this survey, but also as part of our inclusion and diversity work at the RPS, where we understand that if you feel a sense of belonging within your workplace and you feel comfortable in going into that working environment, you generally feel a sense of enjoyment in that working environment as well. You are able to perform to the highest of your ability, you feel more comfortable, you're able to deliver the best form of patient care within an environment. Is there things that we need to do, whether that be guidances, resources, toolkits, demonstrating best practice to the workforce and employers around how to create a positive culture to ensure our teams excel within those environments? And lastly is about access to support, whether that be current employer or NHS funded services, both mental health and wellbeing support services, but occupational health services, but also accessing support that's already available to people from the NHS, from pharmacist support. But that whole idea of destigmatisation, the destigmatisation around accessibility to these, and people not being afraid to raise risks and go for these type of opportunities as well. There's a lot more detail around some of the key 3 areas and some of the principled asks we've got on our website, and the link is within the slide deck as well for people to have a read around and access later. So I'm just going to bring in Danielle, if that's okay, just for a bit of a discussion, and particularly from a pharmacist support perspective around, are these common things? From the initial data findings, Danielle, are these new findings? Are these common? What does it mean for your initial reflections on them?
Well, I think you touched on it. I mean, this isn't just one survey. It's data that we've been gathering over the last few years, and it's all had a common theme. And I think absolutely it's in line with what we're experiencing at the charity. I mean, the results, if we look at them, are quite similar to last year. So I think, like you said, that highlights that the pandemic has only added pressure, and that there are underlying problems that we need to think about. I mean, the figures are worryingly high, 89% high risk of burnout. We really need to address these as a profession. Just reflecting on some of the detail, I think, of the results and the things that came out and comparing that to what we've experienced definitely in the last few years is probably the proportionately high number of inquiries we get from pre-registration trainees and early career pharmacists. And it did come up in this survey that those people are a little bit at higher risk of burnout. So what's going on there? What do we need to understand? What extra support might that group need? I think for us as a charity, you touched on the fact there is access to some mental health support, but lots of people don't feel comfortable accessing that support. I mean, 44% said they don't feel comfortable accessing that support from their employer. And that's something we've been aware of for some time. And I think it's partly the reason back in 2006 why the charity became an independent charity. We knew that independence is really important because there is worries and concerns about raising some of the issues some people face. So we are committed to continue to kind of develop our services and make sure that independent confidential support's always there for all pharmacists. I think worryingly is the workplace culture that you picked up on and how we change this, because there is a certain stigma around mental health and well-being in society, but I think even more so in the profession. I think, as caregivers, as people out there to help other people, a regulated profession, there is extra worries and pressures, and I think extra reasons why people don't necessarily talk about some of the issues faced. And earlier on in the pandemic, we talked about this in our Act Now campaign. We were encouraging people to share their stories, and people really valued that, particularly people talking through how they'd overcome certain things and how they dealt with certain issues and things, and particularly around mental health issues. And that's definitely going to take a partnership effort. And Ravi, you talked a lot about partnership. We all need to work together if we're going to make a change around the stigma around mental health, make changes and make people feel more comfortable. And I think all the feedback when we do that is really, really strong. A particular area of concern for us, and again, you picked up on this, but 45% of respondents who identify as Black, Asian or minority ethnic were unaware of kind of the support available. And it was much higher, that awareness, with people who identified as white. So for us, what are the barriers there? That's really concerning. We want equal access. We want to understand. So why are the barriers? And I think that's something as a charity we're really keen to work on next year. We want to make sure every pharmacist has that equal access and feels comfortable. And I think all in all, just looking at the results, it just proves why the wellbeing agenda is so important and why our work together is going to be so important, because, the figures are worrying and we need to make a change in the profession. And we need to make sure, that support's available. And it's in turn with what people want. I think we should take a few positives, because there was one positive around the fact that people did feel they'd have more recognition through the pandemic, and I think that's long overdue. It's been really good, and unfortunately it's taken a pandemic for some people to get that recognition, but I think there has been an increased awareness just in the general public of the crucial role that pharmacists play. And without them through the pandemic, they've been the face and at the front line for many patients and have made a huge difference to them. So for me, it's really important now that we focus on the wellbeing agenda, because, we've proven how important pharmacies are for the general public. But to continue to support the general public, pharmacists need to look after themselves. So I think that's where our role is now, to make sure they're looking after themselves to ensure they can keep helping other people.
That's really helpful, Danielle. That's great reflection. I couldn't agree more. Would you like to just, it would be a good segue for you to maybe talk a bit about the role of pharmacy support, particularly around the accessibility of support services and what you guys are doing, what you guys have been doing last year, but also pushing forward for this year.
Yeah, absolutely. Definitely. So for us, as kind of a professions independent charity, we have been focused on wellbeing for some time. Prior to the pandemic and last year, we raised a lot of awareness around the fact we felt there needed to be more done to raise awareness of wellbeing as an agenda item. We did this survey last year and it highlighted many similar things. So this hasn't just been brought about by the pandemic. We launched our new strategy back in January, which obviously seems such a long time ago, and there's been a lot of change, but all of that still stands. And we had a renewed focus on wellbeing. We have a vision that no one in our pharmacy family will face challenging times without us by their side. And our mission is that to champion the wellbeing of our pharmacy family. So to us, wellbeing, is at the heart of what we do. I think as the pandemic hit, we thought, well, what do we need to do quite quickly, because this is going to become even more important. And we were very aware of the results last year and the fact that, the high levels of burnout we're exiting last year. This is pre-pandemic, but we wanted to help people maybe just feel a little bit more supported. So there's a slide up now of our Act Now campaign, which we did launch in May, because we were very conscious that the pandemic was only increasing stress and anxiety, and that people felt quite isolated. There was a lot of change, and there was a lot of change for everybody, but for pharmacists, they had a lot to deal with on the front line. And you mentioned before, not always having all the tools they needed to kind of get on, and having to just get on with it, maybe not having all the full details, and that just increased anxiety, and particularly for those who had families who were vulnerable or were vulnerable themselves, and making decisions about whether they were able to be on the front line. So we did launch our campaign, and to back this up, it had the Wardley Wellbeing Hub. So that was lots of tips and tools for how people could proactively help themselves. And I think that's really important. There's only us really that can prioritise our own well-being. We can promote it through the campaign, and we can encourage people to think about it. But, people need to address it themselves and think about it themselves. I think as we move on and we think about our strategy, you highlighted kind of an issue that we picked up on our strategy when we developed it back last year, around a lack of awareness of the charity. And that's really concerning for us, because we offer some great services, but if people don't know about them, what we're going to do, we can't help all the people we can. And although 70% of respondents said they'd heard of the charity, which is an improvement and we're really pleased with, the fact only 13% felt they knew a lot about us shows us huge amounts of work for us still to do. And I think to do that, it's just really important that we continue to work in partnership with a range of organisations, with yourselves as the RPS, with employers to pass on that information, and to just make sure that everybody is aware of the breadth of services we offer, because we not only offer kind of those crucial services at the point where people might be facing crisis, but we offer lots of things in advance so that hopefully people don't get to that point. I think the survey results for us are just really important, because we're committed in our strategy to developing our wellbeing services, and the data is brilliant because it really helps guide us. And I think people's suggestions around what we could be doing as a charity will definitely guide our wellbeing development into next year. I think for us, some survey respondents definitely want more resources for staff, for employers to share with their teams. They want to see more wellbeing events and workshops. So I think we're going to talk about that later. And many people talked about pharmacists maybe receiving some training to offer peer support. And we're really keen to develop our peer support. We do have peer support for our volunteer-led Listening Friends service. And actually that celebrates its 25th anniversary next year, and is a really crucial service. And I know people who use it benefit from it, because, it's manned by trained volunteer pharmacists who understand what it's like in those roles. And sometimes you do just need to talk through what you're going through to get that off your chest. So that's something that we're really keen to develop into next year. And then for me, it's about making sure that everybody has equal access to that mental health and wellbeing support, and to remove any barriers. I think mental health services are hugely stretched at the moment, and I think the pandemic has only made it worse for everybody. And 43% of our professions said that their mental health was not good or poor. So we need to make sure all those people do have some form of access. And we know, we've touched on it before, but we know our independence is really important there. We know that people do feel uncomfortable sometimes reaching out to their own GP, using employer-led services. So we just need to make sure that there is access to that support. And I just think for us, when we've been planning our activity for next year, we've had our long-term goals in mind. So we did launch our strategy, and this is all really important to us. As I've mentioned, we need to make sure more people are aware of the charity, just to make sure no one's left behind. We need to actively work together as a profession, and it's really good to see more partnership working, but I think there's still more we could do. From our survey, which we use to inform our strategy development, people in the profession wanted more organisations to work together. There is lots of information out there, and I think particularly when you're in a global pandemic, it can feel like absolute information overload. So as a charity, I think we're in a good position to at least signpost and make that easy for people, because there's a lot of support out there, but if you're not aware of it, it's not going to help you. I think a really important one for us is to see pharmacists empowered to improve their well-being and to create that more resilient workforce. Because, you know, the pandemic has shown that it's been really tricky and it's hard, and we need to prioritise well-being. If we don't look after ourselves, we can't look after other people. And I think there's definitely more the charity can do, working with others to kind of build that and to help people kind of building good well-being practice into their lives. And unfortunately, that's something that we need to keep working on all the time as individuals. And I think we all know that. We all have bad habits that we need to think about how we protect our own time for well-being. And lastly, for us, it's just about making sure we're here as long as we can be for pharmacists. It's a bit of a balancing act for us. We want to increase our impact and make sure what we're doing really helps. We do need to raise money as a charity, but I think the survey is really important because it allows us to focus on the areas people want us and need us for. We do have limited funds, so we need to make the best of that money, and we need to look at ways we can bring in more money to the charity to increase our support to the people that need us. So that's just a little bit about what we're thinking of doing next year.
Thanks, Danielle. That's really, really great. I'm able to change this. That's fantastic. So I suppose I think this brings in now the next bit around just finishing off a little bit about the role of what we want to do as both organisations collaboratively together going forward. I think we've alluded to it throughout both of our conversations and throughout the presentation at the moment in time, but it would be really good to get feedback from people who have joined us this evening. So we are absolutely committed to contributing to the evidence base around mental health and wellbeing amongst pharmacists and their teams on an annual basis. And I think it provides a good benchmarking for us to see if there's any progress that's being made and actions being delivered on from, you know, various organisations and partners that we're trying to work collaboratively with. And I couldn't agree more with Danielle around this need to, you could really go gung-ho around working with other organisations or try and work in a collaborative environment to create something much more positive. And we are keen to work in collaboration with government, regulators, employers and the NHS to try and address the causation factors, but to try and create the right well-being within a working environment, that culture that promotes positive mental health and well-being. This destigmatisation occurs in a number of different areas, including a number of different areas of inclusion and diversity as well. But how do we ensure that people feel confident and feel able to go and speak about their mental health and well-being and access to support services when they need? And there's a bit around raising awareness around some of this stuff, but also making a bit more relaxing conversation to those to have between your line managers, between staff members in a much more comfortable manner. And then from our perspective, we are really keen to how do we support you and members. So we want to be able to provide some direct support, wellbeing for our members, not only workshops, events, engagement, networking opportunities. RPS has stuff like mentoring platforms, one-to-one support services, but also sharing tools, approaches and best practice and practical tips to help you and your teams on a day-to-day basis. And so as part of this, and I mentioned this earlier, is around our workforce support, our wellbeing support hub, which has a number of these very useful resources on them. And this is free, whether you're a member or not a member. You can, if you're a member, you get access to these, but also because of the COVID-19 pandemic, we've made these available to absolutely everyone. It has absolutely everything you could think of on this landing page, from pharmacy support activities to some of the really useful resources there about sleep hygiene, mentorship, networking opportunities, training support, how to create the right culture within your working environment, some practical tips for pharmacists on managing their well-being on a day-to-day basis. So I would highly encourage people to go and check out the website. It's got some really fantastic resources in there, but anything that you think is also missing from this website or think could be useful to add that we might not have found, it'd be really good to share some of that feedback with us as well. So some of the next steps before we go to Q&A afterwards, what we plan to do from January 2021 is launching a Create Change, that name may obviously change, a wellbeing campaign from early new year. And what we want to try and do is to get members who are engaged with this topic to come and work with us to try and develop a positive delivery plan that try and produce these changes going forward for the future. We want as many people signed up to this campaign to be able to use not only the evidence base we've created from the survey, but to be able to go to key organisations and say 2,000, 3,000, 4,000 pharmacists have signed up to creating positive change around their workforce well-being, and particularly around the prevention, of course, or access to support. And we think that could be a really powerful tool to having some of those conversations. We want to create a focus group or an action group to help us around the delivery of our workforce wellbeing delivery plan as well, helping shape what the RPS does and pharmacist support does going forward for the future. So we really engage and interested people would be interested in some of that stuff as well. And we'll be launching that call within January equally. Between the RPS and pharma support, we're looking at how we develop that long-term relationship and partnership with both organisations going forward, because we want pharmacy support to be here for a number of years, and equally the RPS to be here for many years as well. So seeing how we can work on that from not just doing events, but thinking much more strategically about our partnerships and how we support each other. For some of my next slides, we'll talk about the offer and to members and a series of events that are being planned for members within the first few months of the new year. What we're really also keen on is, while we have some of the poor examples of practice on day-to-day from pharmacists as part of the survey, we want to highlight and share best practice examples, resources, tools via communication opportunities, blogs, vlogs, articles, pharmaceutical journals, where people have experienced wonderful employers and have done the right thing by their employed staff members. And we want to be able to showcase to other people how this could work in real life practice. While they are quite separate, there are some nuances between the RPS inclusion and diversity strategy, particularly on some of the evidence bases I probably just talked about earlier, particularly around Black, Asian, minority ethnic staff. But how do we work around some of the tools, our workforce wellbeing pledge outlined in our strategy, to try and ensure that it reflects the wellbeing of staff on a day-to-day basis? As mentioned earlier, we've got our advocacy and policy programme associated with this to try and engage with those wider stakeholders to create change for the future, for now and the future. And as I mentioned earlier, we want to try and create everlasting change here. This is not just a one-off. We're contributing to the evidence base. We want to see the pharmacy profession flourish as we go forward. So as part of some of those next steps, we are really happy to say that from early next year, we'll be running a series of workforce wellbeing workshops for members and for the profession, and these ideas of dropping casual chats for people to come and get advice from key experts and specialists within a number of different particular areas in an open networking environment. So from January, we'll be running workshops on general wellbeing support. We'll be running workshops on resilience and appropriate time management. And particularly for those provisional registration pharmacists who will be going for exams, we think this could be a really useful resource and workshops to help you prepare for that very intense period of revision. And as part of our chats, we'll be using different platforms which are two-way interactive, which allows people to hear from experts around self-care, building positive working relationships, for instance, and getting the perspective from other members on some of their ideas, but also creating an open environment where you're able to share your experiences and discuss some of the issues that you may be experiencing on the front line. And again, that whole agenda around destigmatizing mental health and well-being and feeling people are confident they're able to talk about it is a part of some of the work that we want to try and achieve going forward into the new year. So do keep those dates and times in your diaries and locked in. More details about how you can register for those events will be launched within the new year. So this gives us an opportunity to go to some of the chat and see what questions may have come in. I'm just going to have a quick look. So I think some of the questions that I've been asked from Heidi and from myself was around what would make a difference to you personally. And one of our colleagues has written that there would be need to have more staff and more trained staff in a working environment. I don't know if you had any views on that yourself. Has that been a common theme you've been seeing from some of the things that have come into pharma support about why that poor mental health and well-being occurs because they're not supported in their day-to-day environment from appropriate staff levels?
Mm. I think we touched on it, but it is a cultural change. So we do get queries about the fact that people feel unsupported, and it's not always everyone's fault. Certain managers are not necessarily equipped with the tools that they need to support people who might not be feeling in a great place. So I think for us next year, we're really keen to develop kind of those tools and resources, particularly for managers, because I know there's sometimes a lot of goodwill, but you do need to have the tools to be able to support other people, and you need to know where to go. And I think just raising awareness of some of those kind of triggers and those signs around when someone else might not be feeling great will help to change the culture, will help us to embed kind of best practice. There is poor examples, and we do get, quite worrying stories where people don't feel supported, and that's where our Listening Friend service does sometimes play in, to have that peer support somewhere else where if people feel they've got nowhere else to turn. So I think there's lots of things we can continue to do and things to build on, but I think we need to equip people with the tools. We can't just expect people to know what to do in some of these situations.
Thanks, Danielle. We've also had another comment about people cutting staff levels down to dangerously low levels, and a common theme being seen by many colleagues that are currently on this webinar at the moment. And it's a really tough time, I suppose, to see that, considering the demand is so high. And I think there is we've definitely seen that as part of our survey. A lot of the responses that we got back was around low staffing levels, on the bare minimum, trying to deliver clinical care in a safe and effective way. And I think there is examples of best practice where we've seen employers really invest in their staff, training, good staff levels, and empowering the pharmacists to make appropriate decisions by having that support and infrastructure in place. But we have heard a majority of examples where there is a fear of low staffing levels which can compromise patient care. And it's a key part of the agenda which we need to talk to employers around going forward for sure. I think that's a key part of some of our ask about appropriate staffing levels, but also adequately trained staff to support not only the pharmacists, but the whole team, and most importantly, support patient care. Dan, didn't know if you wanted to add anything about that cutting staff levels down?
Yeah, I mean, it's a theme that we've heard about, and I think for us, we can do a lot of proactive work around wellbeing, but if we don't remove some of the things that are having an adverse effect, some of these external factors, and funding is definitely an external factor, it's a huge challenge, particularly in community pharmacy where, it's a struggle, and demand has been really high, but there's still the funding pressures that were there prior to the pandemic. And we need to address that in the profession because we can do a hell of a lot to support ourselves, but some of these underlying things, if there's just, staff pressures, there's all these added pressures being put on teams, then no matter what we do, it's just going to become increasingly challenging.
I've had another comment come in from Leslie, she won't mind me mentioning that, around protected learning time and allowing pharmacists to focus on self-care being essential. And actually, that's a really good comment. As part of one of our kiosks, and the response we got back from membership was that was a really key area for people to get that protected learning time. But also, more importantly, just general breaks, for lunch, or enable that flexibility. And I think particularly in England, where we saw that people could open slightly later because of the demand and the busyness early on in the pandemic, closing for lunch where appropriate, ending a little bit earlier to catch up on workload was a consistent theme we saw from the survey results as well. And I think what we're seeing is around that protected learning time, getting those skills, whether it be clinical, whether it be leadership skills, that resilience skills, is crucially important for pharmacists to gain access to. And there is that piece around enabling that to happen through employers, but there is another conversation around government also supporting that from a commissioning landscape, I think, alongside the NHS. Again, Danielle, is that commonly you seeing pharmacists being asking for that through pharmacist support? Any suggestions or advice that you might have had around it?
I think there's lots to learn from the pandemic, and as awful as it's been, I think people felt more comfortable because the pressure was so high to take those breaks. And we had some great stories around when people had closed the pharmacy over lunch, which you'd never done before. You know, we'd had that permission to work a little bit differently, and they did that. And, you know, the theme around team came through so strong for us. It was closing the pharmacy and taking a little bit of time, and we were being asked for wellbeing resources and things the team could use, just easy things. And we kept going back to basics in all the things that I did, the Facebook Lives and the promotion of wellbeing. We were talking about, you know, you need to make sure you're taking breaks, you need to make sure you're eating, you need to make sure you're drinking. And I know that sounds so basic, but people have just been so busy. So I think there's a lot to learn from how pharmacy teams have dealt really well with some of the issues brought up by the pandemic. And I think that protected learning time is so important. And I think we just need to consider, we know that it's not always easy in the middle of the day. How can we make our resources and things more accessible so people can pick them up when it's more convenient for them? Because what we don't want is to increase pressure and add to people's to-do list to say, oh, well, I must watch that workshop or I must do this. It's about kind of finding that thing that fits into people's lifestyles and is a little bit more accessible. And I think there's definitely more work to be done there for people to pick it up in their own kind of leisure time or in the evenings, and it's not an added pressure in the day.
Yeah, I can imagine that. Actually, that's a really, really good point. Actually, can you imagine trying to, and we've seen it quite often where you're managing, trying to scoff down a sandwich while trying to deliver meal, while trying to do some learning, then going back home to families, loved ones as well, and trying to manage that part of the work-life balance is really tricky. And again, that was another consistent theme whereby protected learning time, protected breaks would definitely help with that work-life balance, particularly in the evenings when it can be quite chaotic, particularly those people with children as well. I haven't got any more questions or comments at the moment. Danielle, any last reflections before maybe we've got a few more minutes left? Anything else you wanted to add as part of this?
I mean, I'd just personally like to thank everyone who completed the survey, because I think that's a really good response rate, and I think there's lots to be learnt from that. It definitely shows the need for the wellbeing agenda to be high. It definitely is reassuring for us as a charity because our strategy is all about wellbeing. The next 5 years, we are totally focused on making sure the support's there. I think the events we have planned are really good, particularly the drop-in events, because we want that interaction. We need to develop our services to make sure they're actually meeting the needs of the profession, and we will keep doing that. And I would just urge people to take a little bit of time to focus on their own well-being. You know, we're going into Christmas now, and I know, having spoke to some people, they are taking a bit of a break. And I think we all know when it's been very hectic, adrenaline runs, you just keep going and going and going. And it does feel like people are crawling to Christmas a little bit and to a break. And I think, you know, a break does give time for reflection, and it is okay. I think when people do reflect back, you might feel not great about it. And I think just taking that time to digest what's happened in the last year is really important. We've got some resources in our Wardley Wellbeing Hub that can just help, you know, have a little read through, particularly around sleep and getting that relaxation time. But for us all not to feel guilty, I think when we do stop over Christmas and reflect back, you know, we've been through a huge amount of change, and with a huge amount of change brings a lot of different emotions. So for everyone to just take care and not to be too hard on themselves, I think everyone's done an amazing job over the last year, and hopefully 2021 will be a little bit more positive. And I think for us, we've got lots of exciting things planned, so it would be good to get that engagement.
So eloquently put, Danielle. That was great. I just got a really cheeky comment from Leslie around just going back to basics about eating and drinking with while wearing a mask proves to be quite challenging, and I completely resonate with you on that, Leslie, as well. Completely agree. So just to echo some of that from Danielle, you know, the response that we've got has been fantastic, and I'm very, very grateful that members, the profession, are helping us with creating the evidence base to produce some real positive change for the future. This is not the stop for us. Now we've published the report, fantastic. It's really about the action that follows after this and what we can do collaboratively together. And when I say collaboratively, that's just not across RPS and pharmacist support, that's with members, people of the profession. You are our biggest voices And by working in unity and collaboratively, I think we could create some really positive things. As Daniel said, both organisations have a lot of very useful resources on their website. Please do, if you get a moment and some time out, check it out. There's some really useful things. I suffer from really poor sleep hygiene, and I've used some of the stuff that's on the RPS website and Pharmacist support website. It's really useful coming up, which has been a really busy month in December. We're really keen to keep this conversation going. And so if you have any ideas, thoughts, and you haven't been able to express them today, drop either organisations an email. My personal email address is here. You're more than welcome to give your own reflections after this, reflect back on some of the findings that we've had, and some of the ideas that you would like us to take forward. As I mentioned earlier, we're going to be launching a proper full-fledged campaign in the new year, give some people some time to rest over the Christmas period. And we want people to register for that and sign up to it, be part of our focus group and action group. Let's try and get some of that expertise around the table to help drive what the RPS does going forward by working with employers in government, and NHS organisations, a regulator, around things around really making this a really positive profession for now and the future. Once again, just want to say a massive thank you for everyone's efforts across the whole of the profession trying to support the COVID-19 pandemic. You're all incredible heroes, and most definitely deserve the recognition of all of your hard work over the last 12 months. With that being said, I hope everyone has a fantastic evening, and I look forward to engaging with you all again in the new year. So once again, thank you very much for this evening and joining. I hope you have a wonderful evening, and speak to you soon. Thanks.